Hey everybody, it's Kirsten Karchmer, and I am so excited to be coming to both Australia and New Zealand this fall. I can't wait to meet all you guys and share all of the information that I've come up with after doing fertility acupuncture for the last 20 years. During that time, I was able to work with over 10,000 fertility patients, and literally, I spent the last 20 years trying to hack the whole process, both from a business perspective and from a patient perspective. And here's the things that I found that give people the hardest problems. First, we have to understand, once we get patients to come in for a consultation, how to make the consultation not only diagnostically really relevant for us so that we leave with a really clear diagnosis and concise plan about how to treat them, but equally as important, how do we translate that so that the patient really understands that it's beyond just sticking needles in a person, that we really understand the intricacies of both the menstrual cycle and the basal temperatures, signs and symptoms, and how they're all related to that person's ability to either get and stay pregnant. And that'll be the first thing that we talk about. The next thing is that once we get them into care, we have to make a treatment plan for them, and we'll talk all about the most effective treatment plans that we've come up with over the last 20 years, and also why we do what we do and how to have those conversations with your patients so that they're coming enough so that you can actually make a difference for them, right? If they only come 3 or 4 times, they leave and say, I tried reproductive acupuncture and actually it didn't really work, but they only came 3 or 4 times. This is terrible for our profession, and it's really bad for your practice, and it's bad for the patient, right? Because they don't get what they want. Next, after we've done the consultation, we made the preliminary diagnosis. I've been pioneering the ability to make a very precise diagnosis, to be able to sort of boil it down to 6 different categories of diagnoses and use that to have a very, very precise and reproducible diagnosis. That means that we can train every single person in your clinic to be able to diagnose as strongly as me or as you at the end of this workshop. And then also to create an herbal program that can be for the whole month. At our clinic, we only prescribe on cycle day 5. So we prescribe for the whole month, right? We're working at the constitutional level, not at the symptom level. So you are able to see much better results. And then to learn how to actually quantify all the symptoms that you're using to defend your diagnosis. When this happens, clinicians have the ability to get significantly more confidence in their ability to make a really great diagnosis and then deliver the treatment plan that's going to make the biggest difference. And most importantly, on cycle day 5, coming back and being able to really dissect what you did, what you didn't do, and are there measurable results that you can share with both your team and, more importantly, with your patient. Because one of the most important ways to keep patients in care is to be able to quantifiably show them that what you're doing is making a difference. Because if you can't do that, you can't keep them in care. And like I said before, you can't keep them. And so then we'll break down into exactly how to use the basal body temperatures as a diagnostic tool in a way that you've never learned before. Basically, you've been hacking it forever, and I'll teach you all of my tricks so that you can literally look at a BBT at the end of this course and you'll be able to say, oh wow, looks like, at least as a starting point, this person has kidney yin deficiency, liver qi stagnation, and yang deficiency. That's how good you'll be at the end of this course. I'm not going to be lecturing the whole time because that's way too boring for all of us. Where the real value is I will teach you part of this and we will practice. And I will teach you part of this and you will practice. So that at the end, I want you to leave our workshop thinking like, holy crap, I'm going to be a completely different practitioner. My practice is going to run differently, and my patients are going to have completely different outcomes in 2 short days. So I'm super, super excited to meet all of you. I hope that I will be able to demystify the whole process of diagnosing and prescribing both acupuncture and herbs across the menstrual cycle for fertility patients and for all women patients. I was just talking to one of my consulting clients, the other day, and she was like, well, what about patients who are menstruating but not trying to get pregnant? And I told her, I said, you'd be crazy not to use this system on every single patient who has a menstrual cycle, because the system is so complete. And the information that you're able to glean from the menstrual cycle and the BBTs is invaluable to making a great diagnosis. So shoot us some questions if you have any. Otherwise, I sincerely hope to see you all. The course is filling up, so make sure not to wait too long because I want to make sure everybody gets in that can. I want to be able to give you a lot of personal attention, so the course will cap out. All right, great. I can't wait to see you again. Take care and have a great evening.